the role of the African Union changed from the former Organization of African Union, who worked and spearheaded the total liberalization and decolonization of Africa from her previous occupiers, to what is now known as the African Union, with very clear objectives to promote human and social affairs on its soil.
The AU has got very clear objectives, and one of those objectives are to promote social development, social and human development on the continent. Now, in my 6 years as a commissioner, we have dealt with HIV/AIDS, with malaria, with TB, with all the social ills. But there was this issue of maternal mortality. And as many people would tell you, if you look at the health of a nation, you look at the health of women and children as the key indicators of development. And so the African Union therefore decided that maternal mortality is going to be one of its key strategies for the next years to come, and hence the launch of the campaign. Basically, it's not to say that nothing has been done on the continent, but it was important that the African Union gives its voice to the issues that are of concern to the majority of the population, and which happen to be women.
As Commissioner for Social Affairs for the African Union, Advocate Bince Gowanus sees the current burden of diseases and poverty on Mother Africa's soil as part of the continent's growth challenges.
I think we should look at the disease burden in Africa and the issues of maternal mortality in the context of Africa's development. And one of those issues definitely are the issue of poverty. Women are amongst the poorest of the poor, to start with. Now, if you are talking about a woman, then you are talking about a woman that will use her last penny for her family. If it's not education, it's going to be health. Now, in the situation where you have a woman that is sick, that you have a woman that has died, the immediate effect on the family is very much evident. But secondly, women are the stalwarts of their communities. They are the ones that have been the glue that had bind communities together. Now, in the absence of that woman that has been the mainstay of our community, you can also understand the impact that it has got on the community. But really, for me, maternal mortality and the focus on maternal mortality brings back the question of the value of women within our society. The issue of women's health is a key indicator of development within a given country. And therefore, if the government invests in women's health and in children's health, I think that is a sign of a very committed government.
Namibia is the 9th country where CARMMA was launched in mid-December 2009 after the maiden launch of CARMMA took place in Ethiopia beginning of July, followed by Mozambique, Malawi, Rwanda, Nigeria, Swaziland, Ghana and Chad. Senegal, Tunisia and Zambia will follow and is expected to be part and parcel of CARMMA beginning of 2010. These were some of the role players and developers of CARMMA in the safeguarding of safe motherhood, safe deliveries, and reducing maternal mortality in Africa. Remember, when you're pregnant, you want your baby to be healthy and enjoy the fruits of your body. You want to see your baby going through the paces when he crawls, his first steps, even his first words when your baby calls you mama for the very first time, in order to achieve a safe and healthy lifestyle of baby birth.
I think my first advice will be that to seek medical help. Don't stay at home, don't hesitate. We are there for them. And we are waiting, we are going through them through the journey of pregnancy, and we will take it through till the end, till the baby is born. I also want to make use of this opportunity to invite the partners. That it is so important that they should have a supporter during ANC and during labor.
Do not delay in recognizing when there is a need for medical care. Do not delay in reaching healthcare facilities. The Ministry of Health, through their mandate, provides hospitals and clinics across Namibia to ensure a healthy nation. Do not delay in receiving adequate and appropriate health care.
During your labor time, they are there for you. If you say, sister, please come, they're very quick. They run over you. They come and help you with the baby. And they give you a good service. And I'm very proud of them.
It's a very important procedure for expecting mother, because we are taught so many things that we really don't know as a mother. I mean, it's an experience for every pregnant woman. So they actually guide you through the process, what to expect, and it shouldn't be a surprise to you. You shouldn't really be scared of this and that. They are there to help you and guide you at the same time until you deliver your baby healthy.
Be responsible. Be a CARMMA mother.